It's a difficult topic to talk about, cancer, but it affects so many people, and it's important to know the options of treatment. So here with information about the latest advancements in pancreatic cancer treatments is Dr. Mark Bloomston. He's from South Florida Surgical Oncology. So great to talk to you this morning.
Thank you for having me.
We were just sitting here kind of chatting about the advancements, and you are actually here to give people a little glimmer of hope in the advancements in technology and options out there for people dealing with things like pancreatic cancer. But when you hear the word pancreatic cancer, it kind of stops your heart for a minute. It kind of makes you just kind of stop there and hold your breath for a minute, because I think a lot of people hear that and they think, well, that's aggressive. That one's kind of hard to beat. But there are survivors out there.
That is true. There are survivors, and you're right. It gets bad press for good reason because there are so few survivors. But the patients that are able to undergo surgery and have their tumors removed are the ones that do have hope of survival. And there are cures out there. We know them. They're here in the area. And we're seeing more and more of them all the time.
Good. And you know, I was telling you too, it just kind of, I can kind of take a breath hearing that. I've had some family members and friends who have gone through this, and it's nice to just hear that people out there are focusing on it, and people out there are there to help if you do get that diagnosis. So, can it be cured?
Absolutely, it can be cured. And the key is surgery. You have to be able to have this tumor removed. The problem is that it's a very complicated operation. I always tell my patients it's a life-changing operation, but it's not a life-ruining operation. Patients can make a full recovery, get back to normal lives, and if the tumor's removed, they have a shot at being cured.
So what is considered a high-volume pancreatic surgery program, and do we have those type of programs here in Southwest Florida?
Well, studies have shown that if you have these operations in a center or with a surgeon who has lots of experience and does a lot of these all the time, that the outcomes are much better from a perioperative standpoint in surviving the operation and making a full recovery, but also from a cancer standpoint. Traditionally, a high-volume center has been considered one who does at least 16 of these a year. We now have a program in place where we're doing close to 100 of these here a year in Southwest Florida. So we now have a great team with excellent outcomes where we'll now be able to give that hope to these patients.
Who would be a candidate for that type of surgery?
Well, you know, a lot of times people discriminate against age, and that patients who are older are not candidates for these major operations. But you know, the older patients are the ones that get these diseases very commonly. So it's not so much an age of a patient, it's the underlying health of the patient. So if patients are able to withstand the operation, which is the majority of the time with greater than 95% outcomes, then they are a candidate for having attempted cure.
Thank you so much for your insight this morning. Thanks for everything that you're doing. Also, be sure to head online and check us out. We'll have all of this information and this interview posted online on our website as well. That's fox4morningblend.com.